Hello guys, you all are welcome back to my channel once again. So based on the messages I've been getting, based on the calls I've been getting, majority says I should tell them the step to process the healthcare assistance visa to the UK. So that is what I am going to say today. So stick back to my video, watch till the end, because definitely you're going to learn one or two from there. And even if you are not at the moment trying or planning to relocate to the UK, on the long run, it will be helpful to you, to your family members, to your friends, to your loved ones. So share this video, let people be aware of it. So many people are not aware of the steps to follow, and here I am to talk about it. I'm gonna say to the best of my knowledge. I'm gonna assist you to the best of my knowledge. So stick back and watch to the end. And for the people that are just coming across my video for the first time, they're just coming across my channel for the first time, please subscribe. Yes, subscribe, because it's gonna be interesting, it's gonna be fun, it's gonna be God's boost as well, because even if I give you the good news and I don't give you the bad news, you're not gonna learn from it, definitely. So guys, we do good and the bad news as well, so that someone will learn, people will learn out there. Please subscribe, turn on your notification bell for all this. And to all my returning subscribers, thank you very much. I'm very happy for you all that take out time to watch my videos. I'm really excited. Thank you very much. So guys, I'm going to give you step by step to process for the healthcare assistance visa to the UK. Though there are so many routes, but I am going to share the one I am very knowledgeable about and can share correct information, which that's what I'm going to do. So yeah, I've gotten up to 10 or 11 steps, and we are going to start from the first to the last. I'm going to explain some of these things in a very brief way so that the video will not be too long. So the number one step is get your international passport first. I know you wouldn't want to travel without an international passport, which is not possible. So the very first step is for you to get your international passport ready. Then you start the processes. So the second step is you do your IELTS test with British Council. So the IELTS test is to test your English proficiency. So it's an English proficiency exam, which the minimum score for this particular job is like 4.5, which is overall, and a band of 4.0. It cannot be less than that. Instead, let it be higher than that. That's one of the criteria. And this IELTS is valid for 2 years. So you've got a lot of time, even if time the run. So you've got a lot of time to arrange yourself, prepare yourself for your traveling. So if you have passed that IELTS test, then you can now start registering for K courses to have certificate. It will be helpful, at least you will get some knowledge about what you're going into and to what you are going to see in your job. It's not really expensive. I think it's just 10 to 15 pounds, which is very affordable. So the third step, the number 3 step, is prepare your UK standard care CV showing your role as a care assistant. So after you have gotten those certificates, care certificates, you can now add it to your CVs while you're preparing it. While you are trying to compile your CV, you can now include the care courses you have done either online or maybe you did it direct. You include those ones in your CV. Like they said, experience is the key, and this is one of those things that is needed as a healthcare worker. So even if maybe you have not gotten the experience, you can find a hospital to volunteer for at least maybe 3 months or less or more than that. At least they can give you a referral later for the time being you were with them. And number 4 on our list is you do your tuberculosis tests with an international organization for immigration. If you are in Nigeria, there is a certain there is a place you will have to do the test. It's not acceptable from maybe laboratory or maybe any other hospital. They have a center that they do a tuberculosis test, which is they have it in Abuja and they have one in Lagos, if I'm not mistaken. So you do your tuberculosis test with an international organization for migration. So number 5 is you do your police clearance. Police clearance is very important. These are one of those things that they do check, and there is something they call DBS check. It is part of those things that they check while you are trying to process and while you are trying to get a job, even when you are in the UK. It is part of the DBS check. The number 6 on our list is get an international driving license. This will be helpful. The number 7 on our list is after you have done all these processes and you are sure that you have passed your IELTS, then you can now start applying for jobs. There are so many websites and so many links that you can use in applying for jobs in the UK. You can do research online, and then after you have applied and you are shortlisted, you'll be interviewed, and if your interview is successful, then you will get a certificate of sponsorship. So this certificate of sponsorship will allow you to come into the UK legally through the skilled worker route. So it's just for you to prepare for your interview and make sure you do well in your interview so that you can be offered the COS, which is a certificate of sponsorship for you to be able to travel. So another step is after you have gotten this certificate, then you will get a certificate of sponsorship reference, which is your employer is going to give you a number as a certificate of sponsorship reference. And this is only when you have been offered an employment with a particular employer. So the next step after that is for you to get your job title, your annual salary, how much you're going to be paid monthly, how much you're going to be paid annually. And after that, then you get your job occupation code, which is still going to be given from by your employer. So the good thing about this visa, this work route visa, or skilled worker route visa, is that you can come in with your spouse, you can come in with your family, you can come in with the family you've got and you want to bring them to the UK. The only difference is that the plentier they are, the many people you bring, the more you will pay, and that is just the thing. So if you have got a family, if you have got a husband, if you have got a wife and you want to move into the UK with your wife, your spouse, your children, this work visa allows you to do that. And the good thing about this visa too is that you can get your ILR, which is the indefinite leave to remain. And as time goes on, you can even get your citizenship. Yeah, after how many years of being with them, after how many years of work. But while you are working with them, you will sign a contract, and it's good for you to know the contract you're signing, read through it, and make more research on it before you sign a contract. That is another thing. I dropped a video in my channel about that particular one, so if you did not see a video, you can go down and check the video. It is very, very important while signing a contract. Watch and read it very well to your understanding. I know so many people do not read their contract before signing, maybe probably because it's a very long paper, you have to read and read and read. But I tell you, it is very important to go through your contract so that you will know what you should be aware of, what you're going to be doing and seeing. If you're not comfortable with it, you can look for another employer. I've gotten a video about someone that came in through a home care visa route, and she signed the contract, and when she got to the UK, it's changed totally because the employers, instead of her to do the normal time, which was 9 to 5, the employer told her she would have to be going to work from 7 and close by 9. And this is a person that have got a family. She's a lady, she has got a husband and 2 kids, and according to her, she said that the last born was like 6 months and the baby was still suckling. So she will have to leave as early as 6 o'clock so that she will get to the office early, or get to her clients early, and then close by 9, which she'll be getting home late as well. And by that time, maybe the kids are probably sleeping. She doesn't have time for her family, she doesn't have time for her husband, and this really affected her. If not that she knew and she saw and she read her contract very well, she was able to challenge her employer. And then even with that, she left the job. She got another job with another employer, which they gave her a COS as well. So go through your employer. I will encourage you, I will urge you to do that. If you have not, I'm going to drop some links in my description box so you can make more research on it, go through it, and find out things for yourself. You don't just rely on what someone tells you. So make your own research and be knowledgeable about it as well, so that you can be able to defend it if anything goes wrong. So not just to make this channel the video long, if you have not subscribed, I keep telling you, you will learn definitely from this channel. Subscribe and turn on your notification bell so that anytime I drop a video, you will be notified as fast as possible. And I'm gonna see you guys in my next video. Bye.